Friends, welcome to NMBF Coffee Chats. This is a church-based Christian discussion forum where we have lectures once or twice a week that are meant for the community and sometimes for the society at large. Today is one such lecture. It's a social initiative. It's for everyone, and we want to discuss the very serious issue of cancer. And we ourselves have in our small group we have experienced some people very close to us or connected with our families around us who have struggled with cancer. We've also witnessed someone tragically passing away. So cancer is truly a very deadly disease, sickness that affects people randomly, and there is still there is still so much less we know, and a lot of us sometimes are caught unaware when it really hits us. So we just felt this was an important subject since we have experienced, we have been affected by cancer in terms of our relationships and people around, and we have closely watched this suffering. So we thought it's very important to discuss this subject and perhaps keep revisiting this subject regularly. We are thankful to God that we have Dr. Tabassum with us, to teach us, to give us this lecture on cancer awareness. And I just want to introduce Dr. Tabassum Wadasadawala. So Dr. Tabassum is the professor. She's MB and DNB professor and consultant radiation oncologist, convener breast DMG at the Tata Memorial Center, Mumbai. Uh, Dr. Tabassum specializes in breast oncology at Tata Memorial Hospital, Mumbai. She is a passionate teacher, academician, and researcher. She has keen interest in health economics, health technology, assessment, geriatric oncology, breast cosmesis, survivorship, and quality of life. She is leading several research protocols in the area of special interest and is also the principal investigator of several randomized trials, including concurrent adjuvant chemoradiation, uh, fractionation in whole breast reconstruction, KORTUC, a trial evaluating H2O2 as radiosensitizer, role odd OD post mastectomy, radiotherapy in high risk node negative breast cancer. She has more than 70 publications to her credit in various peer reviewed national and international journals. So, a very warm welcome to you, Dr. Tabassum. We are so thankful that you are here at a short notice, and we give you the rest of the time to take lead us on this lecture on cancer awareness. So, over to you. You can.
Thank you. Thank you, Mr. Bijit. And it's always a pleasure to give a talk on cancer awareness and prevention of cancer. So allow me to share my screen.
Yes. Yeah, we can see it.
Yeah. So in this lecture, I would be telling about very basic facts about cancer, how it develops, what is the incidence, what are the warning signs of cancer, and what are the preventive measures that as a common man can take. So let us understand what is cancer or how it develops. How does cancer develop in our body? So this is a very technical diagram. You can see that there are two phases of the body is made of very minute cells, and the cell passes through various phases. And broadly, there are two phases: the one in yellow shade and the one in the blue shade. So in the when it comes into the blue part, or the cell comes into the blue part, it multiplies. And then there are various phases in which the cell grows, the defects are repaired, and so on. So if you see in this diagram, there are gatekeepers, or there are checkpoints at various parts, phases of the cell cycle. So these are proteins that regulate the transition of the cell from one phase to the other, and they make sure that the multiplication is errorless. Normal cell is error free, and it multiplies very diligently, and it is error free. Hence, normally the defects are repaired, and then the cell proceeds to the other phases of the cell cycle. So generally, why a cell grows is because of the growth factor, and this growth factor can be multiple. Generally, in normal human beings, these are the hormonal factors that play role, significant role, and this growth factor is present at the outer part of the cell, and this then sends signals into the inner part of the cell, and then the cell cycle changes in the cell cycle happen. So cancer cells are nothing but the normal cells that have been dividing excessively, and they form tumors, and they do not bear the capacity to repair the defects, and hence their defects keep on accumulating, and they turn into tumors. Tumor is nothing but excessively dividing cells that form obvious swellings in the form, and in technical terms we call it as tumors. So development of cancer happens when this division of normal cells is not controlled appropriately, and the cells are also the cells that are normal cells that are old or not functioning, they self destruct themselves, and then they are replaced by new cells. However, cancer cells, they divide repeatedly, and they are out of control, and they cannot self destruct themselves. Hence, they lead to the formation of tumor. So this is a short video that will illustrate how cancer develops in the body.
Will this have a copyright issue or it won't? Okay, go ahead, go ahead. There is no audio.
There is no audio.
While
Okay.
sharing screen, you have to select the sound also.
Okay. So what do I select
Maybe
here?
stop screen share and share it again. And this time while sharing it, click the sound also. Sound.
Okay, okay. Share sound. Fine, fine.
Yeah.
Got it.
Okay. Just see if it works.
Different to the cells in our bone. Billions of cells. The cells are so small, the only way to see them is under a microscope. Different types of cell do different jobs. So, for example, our skin cells are different to the cells found in our stomach, and they're different to the cells in our bones. But they all have a similar basic structure. Our cells are constantly dividing, dying, and being replaced. This normally happens in a controlled way to make sure we have the right number of each type of cell in our body. Cancer happens when something goes wrong when cells are dividing. The damaged cell might start to grow and multiply too much and form a tumour. This can happen anywhere in the body. For a cancer to start, changes happen in the cell's nucleus. This is its control centre. The nucleus contains DNA. Sections of DNA are called genes. This is where the changes happen. Let's explain. The genes are like the cell's instruction manual. Gene changes might be like a page missing from the manual. So it could be that there is a missing gene. Or it might be that there are too many copies of a gene. Or the genes are not in the right order. This means that the cell doesn't know when to stop and start dividing and where in the body it should live. And a tumour can develop. If this continues, it can grow into nearby tissues and spread to other parts of the body. Blood cancers are a little different. For example, leukemia is a cancer of the white blood cells. Too many faulty white blood cells are made and build up in the bloodstream. So what causes the changes in the cell DNA? They could happen by chance when any cell is dividing. But outside factors such as tobacco smoke, alcohol or sun exposure can make mistakes more likely. Much more rarely, people can inherit gene changes that make them more likely to develop cancer. For more information about cancer, go to cruk.org.
Why is this? Yeah. So,
I think you're on mute. Yeah. By mistake, perhaps you have clicked the YouTube screen. You need to get back to your slide, no? PPT.
yeah.
Yeah. We need to stop the screen share and get back to the PowerPoint. Yeah.
Why is this coming back again? I don't know. I think I will.
Yeah, just you don't need to make it full screen, otherwise just that's okay.
Yeah. So as we saw, mutation is nothing but defect in an of a normal gene, and any tumor a tumor develops when there are known factors that cause this change in the genetic makeup, and these are called carcinogens or oncogenes, and the any agent that will cause cancer is called a carcinogen. So, as we all saw, that if there is a chronic exposure, continuous exposure, there will be cumulative accumulation of the defects. So, it will progress from one mutation to two mutations, and as the mutations accumulate, it reaches to a stage that it transforms into a malignant cell, which has properties that are totally different from the normal cell. So broadly, these are categorized into four types. First is the ionizing radiation, that is exposure to X-rays, UV rays, chemicals. There are different forms of chemicals that we are exposed nowadays. Viral infection, most strongly linked viral infection is the papilloma virus, which is responsible for the cervical cancer or the cancer of the opening of the mouth of the uterus, and then hereditary predisposition. This is the classification of the various carcinogens, the category 1 to category 4. So, in the category 1, as you can see, sunlight, wood dust, alcohol, and processed meat and tobacco, these are proven carcinogens. They are definitely linked with cancer. Then, as you move through the category, the association or the link between these agents and the development of cancer becomes weaker. Hence, it is important to be aware of the carcinogens that we are exposed to nowadays. So as I already mentioned, chronic infections from viruses and infective agents like Helicobacter pylori or hepatitis B virus or hepatitis C virus. These are linked to the malignancies of the gastrointestinal tract, that is the stomach or the liver, and HPV is linked to the cervical cancer. Then there are other occupational and the environmental hazards that are the causative agents, and few risk factors are related to our lifestyle. So this is mainly due to physical inactivity, overweight and obesity, and changing dietary habits. So this is just an example that the cigarette smoke has more than 4,000 chemicals that are identified, and these agents or the chemicals are very injurious to the health, and these affect not only the lungs but even other parts of the body. So, factors that are believed to contribute to global causes of cancer are broadly divided into mainly four reasons. So, the most common reason you can see is related to smoking and alcohol. The next most common, the equally common, is the unbalanced diet and chronic infections and hormones. So pollution and occupation, these constitute less to the carcinogenesis. Hence, there are so many factors that are in our hands and we can control by modifying our lifestyle. So let us understand what is a benign or a norm or a non-malignant tumor, a non-cancer tumor, and what is a cancer. So benign tumors, these are tumors, these are swellings that do not spread from their site of origin, and but they can press or squash the surrounding cells. So, for example, there are many benign brain tumors that are not infiltrative, and you can see warts or moles that are present in the skin and also other parts of the body. But malignant cells or the cancerous tumors, they can spread from the original site and they can cause secondary tumors. So they pass through the blood and then they can form tumors that are distant, I mean, away from the original site. And this is called secondaries or metastasis. And why they are so bad? Because these tumors are then not amenable to cure, and they eat up the body nutrients and cause extreme fatigue, and also the cure rates of these tumors who have already metastasized to other organs becomes difficult. So this is an example of how the tumor spreads. In medical terms, we call it as stage of tumor. So if the tumor is this is an example of a breast cancer. You can see the tumor is in the pink. In the first diagram, the tumor is within the breast. It is not invading the other structures, but in the second diagram, you can see that it has started infiltrating the breast tissue. And in the last diagram, you can see that the red tumor cells have passed into the blood cells, and then they are disseminating into the other parts of the body. Similarly, this is an example of a lung cancer staging where you can see the tumor is in dark blue. And in the first diagram, you can see the tumor is around 5 to 7 centimeters. But in the second diagram, you can see that are multiple lymph nodes or metastasis within in the region near the midline or the heart. And in the last diagram, you can see within the lung, the tumor has developed metastasis. So this is how the extent of tumor or the cancer spread happens, and the extent of spread determines the stage, and the staging then determines the type of treatment that the patient will receive, and also the cure rates, and the chances of living up to 5 years and more. So let us now see how common is cancer in India. So roughly around 14 lakhs of cancer cases are seen in India every year, and you can see more than half of these cancer cases succumb, and hence around 9 lakh cancer cases have a mortality. And if you see the 5 year prevalent cases, means if you count the new cases as well as the existing cases, the burden is around 32 lakhs. So this is a very significant health hazard, one of the most common non-communicable diseases. And I would like you to also pay attention to the number of the distribution between the males and the females. So it is very, very disheartening to see that females are developing more tumors, and also the number of deaths, however, if you see, are more in men. And the risk of developing cancer before the age of 75 is roughly around 10.5% in Indian population. And if you see the top three leading cancer sites in men, these are in the oral cavity, the lip or the oral cavity, and then lung and esophagus. But in females, it is breast cancer that is the most common cancer, followed by cervical cancer and the ovarian cancer. So this is what has been depicted in this diagram as well. So if you see the incidence of breast cancer, this is the incidence per 1 lakh population. So if you see 26.6 is the highest incidence is in breast cancer, and obviously females are at the highest risk of developing breast cancer, followed by cancer uterus, cervix, cancer of the cervix, and the head and neck or the oral cavity tumors, cancers are at the third number if you combine both male and female together. So as we know that these are the hazards and the risk of developing cancer, we have so much exposure to these agents and the lifestyle related factors. So the primary intention should be our intention should be primary prevention, which means that whenever though we are exposed to these risk factors, but we should try and avoid onset of any disease. And in this scenario, today we are discussing about cancer. And then if that stage is passed and anyone develops cancer, so the idea of cancer awareness is to diagnose the cancers at an early stage. Smaller the tumors, earlier the stage, more are the cure rates of cure, and hence that is called secondary prevention. But if that stage is gone, then we can only deal with them, the onset of symptoms, and we can only deal with the disease. And there will be three possibilities: either there will be some chance of cure, or there will be cure but with disability, or that can be fatal. So we should also know what are the warning signs of cancer. So generally, it is an acronym of caution. So you can see that it could various parts of body can manifest differently. And if you have to talk about the gastrointestinal tumors, it will be change in the bowel or the bladder habits, sore that does not heal for a long time. For example, an an ulcer in the mouth or in the oral cavity or over the tongue. Any unusual bleeding from any part of the body is or also a warning sign. A lump or a thickening of any in any part of the body, for example, over the arms or over in the breast or any other part of the body, is also abnormal. And obvious change in the wart or a mole. So since many years we would have a mole or a wart on our body, but if it changes its character or the size over a short period of time, then it is also a warning sign. And for cancers in the thoracic cavity or in the chest, they can manifest in the form of cough or hoarseness. So these are different types of presentations or symptoms anyone can develop if there is something some cancer developing in the body. So the intention of the lecture is not to scare, but to become aware. So you should also be aware that there are many myths and false linkages between different things that we come across in day-to-day life. So everything is not cancer. Up to half of all the cancers can be prevented by changes in lifestyle, and many times confusion is created by frequent media stories, and we then become scary. So now let us talk about, what are the things that we can do to control or prevent cancer. So first and the foremost, as I already mentioned, that smoking and alcohol are the most common reasons. So avoiding smoking is the number one preventable cause of cancer, and it is almost all cases of cancer are related to smoking, and it not only is linked to smoking but also other cancers of the upper airway, the stomach, mouth, tongue, liver, cervix, and bladder cancers. So first of all, it is better to avoid smoking, and if anyone is already smoking, it is better to quit. And after quitting, the risk of cancer development also reduces the number of years have passed from once the smoking is quit. Tobacco also is very common. It is consumed in various forms in our country, and it is the second highest. We are having the second highest smokers in the world after China, and 1 million deaths, adult deaths, happen because of tobacco-related causes, and cessation rates are also very uncommon, and so government has been thinking about high taxation on tobacco products, and programs of smoking cessation is the need of the hour, seeing the number of smokers in our country. Another thing that can be that is very important is to maintain an ideal body weight, and being overweight or obese is one of the most important risk factor for many cancers, and it increases the risk of bowel, breast, kidney, stomach, and uterine cancers. And plus, you'll reduce your chance of developing other ailments or non-cancer ailments like the heart disease, diabetes, stroke, and arthritis if the body weight is controlled. And this is what is the classification. Every one of you must be knowing about the body mass index. And overweight is more than 23, and obesity is more than 25. So it is always good to have a body mass index between 20 to 23. So this is the complications that are that are caused by obesity. So it is not only restricted to, cancer is one of the cause, but it has many other harmful effects on our body, of the cardiovascular system, on the respiratory system, as well as on the gastrointestinal system. So it is one of the important measure which is lifestyle related, and that can be dealt with. This is also a report that was published in 2016, which shows that obesity is so common, and over the years, this hazard is increasing. And in 2014, India was at number 5. But now you can see this is also an older figure, both in men and women. This is really scary. These are all very scary figures. And the Global Nutrition Report published that India ranks 11th in the under 5 obesity. So it is not only the adults, but the children are also obese, and 21st in the adult overweight and obesity incidences. Hence, it is very important to deal with this condition with the by the help of dietary modifications, physical activity, behavior therapy, and drugs and surgery, of course, only in very severe cases. Exercise also reduces the chance of developing colon and breast cancer, and it also has other added benefits similar to obesity. And drinking little or no alcohol is another way of controlling or preventive cancer and many other ailments. Balance of reproductive and hormonal factors. So, pregnancy and oral contraceptive pills increase oral contraceptive pills increase the woman's chance of developing breast cancer, and pregnancy is actually protective. And having late childbirth and having many children has also been shown to reduce the having early childbirth and having many children has also been shown to reduce the risk of breast cancer. Eating a healthy and a diet that is color that has many colors. I mean, it should be a balance between of micronutrients, plant-based foods, including fruits, nuts, and whole grains. And it should, of course, be low in salt and processed meats, because these are very harmful with respect to development of specifically colon and stomach, esophageal cancers. And this again will reduce the risk of cardiovascular diseases and diabetes. And there are known environmental risk factors. These are the chemicals that is most important is the asbestos, nickel, arsenic, and radioactive substances that are linked to the development of cancer, especially lung cancer, because these are directly inhaled. So this is also an example of when the air quality index of Kharghar had gone up. This was the awareness of the citizens, Kharghar residents, that led to this march against water and air pollution. And hence it shows that I mean, as a community, we have to be aware of what is of the climate or the environment that we are living in. Getting regular screening is also an important aspect of prevention, because in certain cancers like breast and cervical cancer, we have measures of early detection, and hence these should be you should be aware of these options, and you should be approaching physicians to get these tests done. And at Tata Hospital, we have the preventive oncology OPD, which in which patients, women or healthy women and men, and anyone who wishes to get himself or herself screened for cancer are taken care of, and this is done on a daily basis. Then avoiding chronic infections also is one of the measure of controlling cancer. As I already mentioned in my previous slides, it is the hepatitis infections that are caused through blood transfusions, and human papilloma virus also that is linked to cervical cancer. Hence, adopting safe sexual practices will reduce the risk of HPV transmission. And medical treatment of persistent Helicobacter pylori infection also can reduce reduce the risk of stomach cancer. Various social and psychological factors are also important because we are living in an era or age of stressful life. The stress is not only present in within the house, at the job place, and there are multiple causes to that, and this leads to sleep disturbances. So having a sound social and psychological health is equally important for well-being. And most important responsibility of cancer awareness lies with this. It starts with yourself and then the community, and breaking superstitions about cancer, that cancer is deadly, it cannot be cured. So these are all the myths that can be busted, and with community awareness. And there are so many NGOs that are doing good job for cancer awareness as well as treatment. And I would like to say that cancer is curable if it is detected early, and hence our aim is to should be primary prevention. And if primary prevention is not possible, then at least secondary prevention, that is diagnosis at an early stage. So, what are the things that you can do more? You can eat a very plant-based diet, taking five to of multiple servings, being physically active, and maintaining a healthy weight, and also practice safer sex, or protecting the skin from the sun with appropriate clothing and sunscreening, and perform regular self-examinations, for example, breast self-examination, skin examination, and testicular self-examination, etc. So preventing cancer is a multi-level task. Multiple domains are involved. So it is there are few certain things that are hereditary which cannot be changed, but individual lifestyle factors are important that can be managed or manipulated, and social and community influences are also there. It also depends on the living and the working conditions, and general socio-economic, cultural, as well as the environmental conditions. Unfortunately, if a cancer has developed, it is a very difficult situation. I mean, a layman doesn't know how to start the treatment, whom to approach, and what to do. So choosing right doctor and hospital is very important, because cancer there is always best chance when it is done adequately at the first time of diagnosis, and hence choosing appropriate hospital and treatment is very important. So it is generally multiple cancers are there, and different types of treatments are available, like surgical treatment, that is removal of the tumor. Then radiation is also one of the therapy, and injections which are given through the intravenous injections. Through them, the chemotherapeutic agents are also given. And any cancer treatment is generally a dedicated cancer hospital is good, because it is the treatment is decided in a cancer board, and there are all specialties available in one hospital. And this leads to multidisciplinary management, which is very important for good cancer outcome. So as I already mentioned, it could be cancer surgery, which is removal of the tumor, or it could be medical oncology department, which gives cures tumors or cancers with the help of chemotherapy agents, which are given orally or intravenously. And radiation is the treatment of cancer with X-rays. The patient is positioned over the treatment couch, and the machine rotates around the patient and gives X-ray treatment. So this is the exam picture of a patient taking injection or the chemotherapy in a ward. And thus, it is a multidisciplinary treatment, and with the help of all the facilities that are available, it is possible to cure cancer if it is detected early. Thank you.
Thank you so much, Dr. Tabassum. Such a wonderful presentation. Now we will stop.